this gel pops off like this. And when it pops off, it starts pressing on the nerve that traverses to the legs. So when that is going to happen, they have this sharp electric shock-like sensation, shooting pain. So these things are more in favor of a neurogenic component. A patient who is paralyzed, if he's able to walk even 70% from what he was, it is a phenomenal outcome. People who are into desk job, they have to remember 5 things.
Hello and warm welcome to MedSynapse podcast series, where we bring you insightful conversation with leading experts in medical field. Hi, I'm your host, Dr. Smarika Bhatt, and today I'm honored to welcome Dr. Imtiaz Ghani with us, a distinguished spine surgeon at Apollo Hospital with over 14 years of transformative experience in spine care. Dr. Imtiaz is certified by the American Spinal Association and seated on the editorial board of Northern America Spine Society. His international training includes prestigious fellowship in Singapore and Germany, specializing in minimally invasive and deformative surgeries. Dr. Imtiaz, thank you for joining us today. We are excited to have you here.
Thank you, Dr. Smarika. Thank you for involving me in this podcast. It's a pleasure meeting you all. Thank you.
Likewise, Doctor. So we'll start with the first question to start our interview with. Let's start with something that affects millions of worldwide people, that is neck pain. So Dr. Imtiaz, could you walk us through the complex anatomy of the cervical spine? I'm particularly interested in how different structure interact with the causes various neck pain.
Sure. So, we are living in a digital era wherein, like these days, people are more prone to your desk, and the desk job thing really is causing a lot of problems, be it the neck, be it the upper or the lower back. There is not much of physical activity that's happening. People don't tend to do much of exercises. They are living in a very fast world wherein there is no time for them to have meals at their proper part of their day. And all these things, on a holistic way, what is happening is affecting their health in a big way. And so we are also stuck to our mobiles all the time, and this forward bending and looking into mobiles for long hours, working into laptops for long hours is also causing a lot of strain in your neck, your upper and lower back. In a day, like if I'm seeing in my outpatient department, if I see around say 25 to 30 patients, easily the number of patients in the younger age group between age of 18 to 25 who come with neck pain or back pain, easily there would be another 10 in that list. That's because, and those are mostly IT professionals and people who are into desk jobs. Okay, that is the main. Again, whenever I ask them, the common problem that they say is, we are working for 8 to 9 hours continuously. We are stuck with all those things, and so these are the commonest factors. So we don't realize it at day one. So it gradually starts building up, and at one particular point of time, only when the situation worsens do they come. And sometimes they don't even come to the doctor. They go to some chiropractor, they go to some therapist. Nobody wants to go under the knife, of course. So they want to try all modalities of treatment like Ayurvedic, massage, physiotherapy, and any other modalities, homeopathy, medicines, and all those things. So having said that, each thing will help to treat the symptoms but will not treat the cause. So taking into account these things, since you were asking, I will just explain with the bone model. Just a minute.
Yeah, sure, Doctor.
So this is the spine. So if I'm sitting like this is the front part of the spine, and this is the back part of the spine. Okay, so here we have the brain, and from the brain you have the spinal cord, which will be coming all the way down, and this yellowish structure that you see in between, that is the spinal cord. The spine. So this particular, when I say spine, it means that it just doesn't mean the bone or the nerve. It means the bone, the muscles that are going to support that particular bone, and the ligamentous structures, which are like plastic sheet-like structures, which are going to help in increasing the tone of the muscle that is getting attached to the bone, and all these nervous structures. So you have from the spinal cord, the center part, you have nerve which is traversing to the shoulder and the arm on the left side and right side, and the same way the upper back and also to the lower back. So this is how it is. So the spine controls the entire network of your body. So we call it the peripheral nervous system. That is, all the peripheries are controlled by the spinal cord, and the main central nervous system is controlled by the brain. So this helps not just in controlling your movements, it also is important for various things like control of your urine that you pass, the motion that you pass. So all these things are basically under control. If at all, that's the reason patients who have an issue like a disc prolapse in the lower back, they come with symptoms of loss of control of urine motion, and sometimes people get affected in the neck, some traumatic scenarios and all those things. They present with complete paralysis from their neck way down. These are so the structures that are important are the nerves, the muscles, the bones that are going to support your neck. So everything has to be coherently managed in a proper fashion by means of a proper posture, by means of doing regular exercises and the diet that we consume. Okay?
The sleeping position, the sleeping position also adds to it.
Definitely matters. People who use those high pillows, they are more prone to get neck pain because of the fact, see, your neck, if I'm going to look like this, your neck is a concave structure. Your upper back is a convex structure, and your lower back is again a concave structure, and your butt region would be a convex structure. So the region where it is concave, the neck and the lower back are the more prone regions for developing a severe strain or a disc prolapse. It's more like a blessing in disguise. Where movement happens more, that is where you will have problems. See, in my neck, I can do a forward bending, backward bending, sideward bending, and rotations and as such. Similarly, in my lower back, I can forward bend, backward bend, and do sideways movements. But if you see my upper back, I can't do, if I'm bending, the bending is not happening in my upper back. It's happening in my lower back because the upper back spinal bone is attached to the ribs. So there is not much of movement. The only movement that happens is the rotation movement that happens. Similarly, in the lowermost part, there are no discs. So if you see, the lower part, the disc ends over here in the lumbar region, beyond which you don't have any discs over here. So here, there is not going to be any movement that's going to happen. All that you can see, expect something to happen in that particular region would be some pathology. If you can expect this would be an infection, some traumatic scenarios causing problems, or some tumors that we generally encounter. So this is about it.
Okay, that was such a detailed description of the spine and a structural approach. So moving on to the lower back, I understand you take a comprehensive approach to the diagnosis. Could you explain how you differentiate between neurogenic and mechanical back pains, and how does this tie into the biophysiological model of pain management?
Sure. So when we say mechanical back pain, if the back pain is limited only to your back, if there is no radiating pain to the legs, so that is when we call it as a mechanical back pain, and it's a vague pain. It is not a pain wherein it is limited to a particular area. So it'd be like a broad-based area. So the patient says that I have pain here, I have pain here. So it is a broad back. So it depends. But when you say neurogenic pain, a pain which is significant to the lower back, which is radiating to the thigh, your buttock, your calf muscles, or if it traverses all the way up to the toes, that is when we call it as a neurogenic pain. Then we think that there is some nerve component which is involved, which is responsible for the entire scenario to happen. So ideally, in the common scenario, what we think is a disc prolapse. So when I say again, I will show you the structure. You can see this reddish thing over here. So it's just an explanation to show that in between each vertebral body, in between each bone, you have a soft gel-like structure. So we call it a disc. So this will be acting like a shock absorber. So what happens is this gel-like structure is held in position by means of some rubber band-like fibers. So when the rubber band tears out, sometimes because of your excessive strenuous activity, this gel pops off like this. And when it pops off, it starts pressing on the nerve that traverses to the legs. So when that is going to happen, that is a situation wherein like a person will start experiencing tingling, numbness, a lot of pulling sensation, won't be able to walk even for a distance of say 100 to 200 meters. Then the moment they try to stand, the moment they try to sit, they have this sharp electric shock-like sensation, shooting pain. So these things are more in favor of a neurogenic component. Many a times there is also involvement of the bowel and the bladder. Meaning they say, sir, I am having difficulty in passing motion only after this particular scenario started, the back pain scenario started. So that is also a component that we need to think about. So coming back to mechanical back pain. So this mechanical back pain is not generally something which is there for like 1 or 2 days. It is something which has been there for a long period of time, beyond 6 months, a chronic pain. And that can be because of different reasons. So it can be because of an inflammatory pathology. We call it as seropositive or seronegative arthritis. So in those cases, what we do is when we see a mechanical back pain, we try doing an X-ray, we try doing an MRI, and if we don't find any neurogenic component to it, we of course have to rule out by means of evidence-based management. When we are not able to find that out, then we do certain blood tests to check if there are any inflammatory parameters in the blood that are getting altered. Like we look into rheumatoid, if there is a problem like rheumatoid arthritis, which is causing the problem. We check their uric acid levels. We check their vitamin D and B12 and D levels. So all these things, and we also look into a particular thing called CRP, which is called a C-reactive protein, and we also look into another blood inflammatory parameter called anti-CCP. So these are the various tests we do. And in one of these, if we find that there is some alteration that's happening, so we manage it, and we also involve a rheumatologist along with us in order to manage this sort of mechanical back pains. And mechanical back pains, sometimes if it's for a short duration, we recommend proper physiotherapy, muscle strengthening exercises to tone the muscle, then your postures again, as I mentioned earlier, and we ask them to do a lot of stretch and strengthening exercises on a regular basis. This is the key to it.
So that was such a vivid description, and since you have touched upon core exercise and the exercise importance, so we'll move on to our next question. Prevention is often called the best medicine. Walk us through the approach if the patient education is important, and particularly regarding the ergonomic and core strength for the patient. How do you make these recommendations practical for the patients? How do you suggest them?
Sure. See, as I mentioned earlier, people who are into desk job, they have to remember 5 things. First, the chair that they're going to use. It should be a chair something like this, where you have a proper back support. Your upper, your lower back should be well supported. There should be a lumbar component to it. So it should not be a straight thing, so that it should be a curved one wherein your lumbar spine is well supported, since your spine is concave in the lower back. So this component will come and it will balance your spine well. That is the first thing. So you sit on a chair like this, a mobile chair with an height adjustable armrest. That is one thing. The second thing is you got to sit as close as possible to the desk level. So you got to sit as close as possible to the desk level and rest both your elbows should be rested on the desk. What people generally do is they sit in a very horrendous posture. They sit like this. They keep their elbows hanging out. They bend forward like this and they keep working. So this posture, exactly. So they keep doing like this, and this starts causing a problem in the long run. So this forward bending, something that is concave, starts to become convex, and that strain is going to constantly keep happening on your disc and on your ligaments, which support your lower back and your neck or the upper back. So this causes the issue. So we need to avoid that. So sit straight, rest your elbows either on your armrest, and keep your hands well supported, because when you do this, what happens is there is no transmitting force from here to the neck because your elbow is rested. If your elbow is left hanging, if I keep on doing something like this, slowly the whole pain starts radiating and goes to your neck, and that causes issues. Similarly, your lower back to the proper foot rest is something that you need to follow. This is the first principle that you need to adopt in an ergonomic thing when you're doing work posture. Second thing, whenever you're trying to bend forward, always keep your back straight and bend by your knees. So I will just demonstrate it to you. So it's like this. So you stand straight, and then like you don't bend forward like that. You stand straight, you bend by your knees and by your knees. So your back is well maintained. That way, you don't cause much of a strain in the lower back, and there is a coordinated lift that you're trying to do with both your arms. Okay, so that's about it. And so this is one thing that you need to follow. Third thing is definitely exercises. A minimum of 20 minutes a day. 20 minutes a day, if you are not able to allocate for yourself, for your own health, and saying that I don't have time, then it doesn't make sense. Okay? So 20 minutes every day and 10 minutes of sunlight exposure every day. Because we work in closed environments, we are not exposed to much of sunlight. And when there is no much of sunlight, what's happening is vitamin D starts to drop. When vitamin D is low, the absorption of calcium to the bone gets hampered. So these are the things that we need to focus and remember if we need to have a healthy bone, and that in turn helps us to maintain a healthy spinal framework. So this is the third thing that I would want to emphasize, and as far as ergonomics is concerned. And fourth thing, people have a very bad posture, like in the sense they try to sleep over their tummy and look into the laptops and work like that. Okay, they just lie on the bed, okay, or over the resting on their tummy. So what again happens is, in your spine on the back side, you have these bony prominences. So these are going to act like a support. But in the front, you don't have any bony prominences such. This is where you have your tummy. So when you're going to rest on your tummy and going to lie down like that, there's an enormous pressure that's going to get exerted over there, and that will indirectly cause a pressure effect on your spine. So that's not good for your back. So sleeping on your tummy is not good. Whenever you sleep, I would advise you to sleep facing the ceiling, keeping a pillow horizontally under both the knees. Am I clear? So horizontally under both the knees. Suppose we are going to sleep on the sides, we can keep a pillow vertically between the thighs and sleep. So it relaxes the stretch pain that happens. So we call it a sciatic nerve. So there's a nerve called a sciatic nerve that traverses from the lower back to the legs. So that nerve is not stretched when you keep a pillow between your thighs, on your sides. Okay, you can sleep on either side, whatever you're comfortable with. But then sleeping on the tummy, I would generally not advise.
Okay.
So yeah, I think these are a few economic postures that you can adopt and yeah.
That was a quite a detailed summary. So we'll move on to the next question of Imtiaz.
Yeah.
So let's talk about the cutting edge of spine surgery. You are the forefront of the implementation of new technologies. How have robotics and regenerative medicine transformed your surgical approach? And how do you balance innovation and evidence-based practice?
Okay, so the newer technologies that have come, spine surgery per se has evolved tremendously over the past decade. So we have come up with newer things like intraoperative neuromonitoring. That is like when you are operating on the patient, we are able to monitor the sensory and the motor component of the spinal cord, that is, the nerves and the muscles that takes up life in turn. So we will be getting a live when you're operating. We know that if we are disturbing something, there is a problem, there will be a signal drop, and that gives us a immediate feedback. Then we stop, then we try to do things in a way so that things go in a proper flow. It's more like an ECG that is done to the heart, where you have a proper wave that keeps happening. Similarly, we need to see a proper wave that keeps happening when we are operating. So intraoperative neuromonitoring makes it more evidence-based, and it makes it a little bit more foolproof while we do our modern surgeries. Because when we do those major deformity surgeries like scoliosis and kyphosis surgeries, these definitely, earlier we used to do what is called as a wake-up test. When we do the surgery, then we also do the correction of the deformity, then we try to wake the patient, and then we will see if they're able to move their limbs and all those things. But that is not something that we do these days. We do the intraoperative neuromonitoring, and we make sure that it is precise. So that way technology is improved. And then coming to intraoperative CT scans. So there is a machine called an O-arm, meaning that when the patient is positioned on the table, we run an intraoperative CT scan of the patient to assess as to how the spine is aligned during that particular point of time. So when we are able to understand that, then the robo comes into picture. So we use robotics these days, and this robotic machine helps us to understand as to when we place a screw inside the spine of the patient, whether we are able to do it precisely to utmost detail. See, in a normal spine, generally, it doesn't make much of a difference because we know the anatomy. We know that here's where the structure is, here's where we'll have to use things and go ahead. That's how we have been doing in the past. But then, to make it more accurate, the intraoperative CT and the robotics has really come a long way, particularly in deformed spines, in congenital anomalies, and when you have a tumor which has eaten up the whole spine, and there is some total abnormality that is happening. So we don't know where we are placing the screws, what we are doing. So in all these concepts, definitely this particular technology helps. And we are able to do with 99.9% precision. And that is good for the patient. Okay, of course, the charges are a little bit on the higher side, but definitely we explain the pros and cons to the patient. And if they are able to afford, of course, we are definitely willing to go that extra mile and do that for them. So that's about it. And a few other things. You were talking about regenerative medicine. See, today, people have been using mesenchymal stem cells from the adipose tissue of the particular individual. They refine it and then they re-inject it. They expect good results to happen. But as such, in spine surgery, we have not seen. See, there have been studies which have been showing that you have your stem cells helping to bring back patients who have been paralyzed back to their legs and all those things. But it is really, I'm telling you, over the last 10, 15 years or 20 years, I would say a lot of studies have happened, but there is no clear-cut evidence that, okay, I do this patient is going to get back to his legs or his arms. Okay, so that situation has not happened, and so we are still working on it and a lot of things. However, there is something called as exoskeleton that has come up. So the exoskeleton, what it does, it is phenomenal in the sense like there is like a robot which will be there, it will be attached to your body, and then you will be mobilized. Okay, when you are getting mobilized, and things, because when you are bedridden or when you're all the time in the wheelchair, your muscles start to go in for wasting. When the muscles go in for wasting, obviously at one point of time we are not able to do much of things, right? So eventually, by using an exoskeleton, all these things gradually tend to improvise. And we have seen people who have started walking from whatever they were from. See, a patient who was paralyzed, if he's able to walk even 70% from what he was, it is a phenomenal outcome. So, and we are happy about it doing those things. And it has also helped us to, in post-operative, we have old patients who are fragile, who are not able to walk, who really need a support, where we are worried that they might have a fall. So these things have been helpful. So we call it as exoskeletons and all these things.
Dr. Yes, so that was an incredible insight on the technology advancement. So we'll move on to the last question for the podcast. Yeah. Since you have an international exposure and have a unique perspective, so what are the key differences you have observed in spine surgery approaches between Asia, Europe, or America personally?
So when we talk about the other countries, as far as I have seen, in each country, wherever I went, it was a center which was specializing for a particular thing. Like for example, when I was in Italy, I was in one of the centers which was called in Mecca for spinal tumors. So I was there in that particular. So I was focusing to learn the concepts of spinal tumors as to how to manage spinal tumors and all those things. Similarly, when I was in Germany, it was a pure deformity center wherein we were dealing only with all those severely deformed cases like hunchbacks, scoliosis, which we call as an S-shaped spine, and all those things. So managing those things was the priority. And when I was in Switzerland, it was more of a degenerative spine, where in old age people, how do we manage their spine? Because it's a whole different scenario as to how to manage it from a pediatric spine to an adult spine. So those things. And coming to Singapore, I was trained mainly to do minimally invasive surgeries and robotic surgeries is what Singapore had taught me. And so that was about. This is one aspect of it. So I wanted to get trained in the different facets of spine surgery. So I tried doing all these things. Having said that, what other thing that I see is there is always a teamwork that's happening over there. It's not a single individual, there's a teamwork that's happening, and when there's a team, there's another alternative mind for you to think, so that you think, okay, I want to manage this patient this way. The other person says, no, maybe you can do this also. So that during the time of surgery, it really makes a lot of difference, which here, not in every center we do have, and of course that is one thing that I feel is lacking. And my association with all these organizations really helped me to understand concepts of spine surgery, then to know the newer advancements that are happening, how we manage patients, what all newer things that we can bring in research, So those have taken me a long way to whatever I am today. Okay, so that's about it.
Okay, thanks so much, Dr. Imtiaz, for sharing your valuable insight with us. I'm sure our audience will gain a lot from it. And thank you to our viewers for tuning in. And remember, if you're a healthcare professional who is eager to delve deeper into medical topics or have questions, do not hesitate us to join our MedSynapse platform. MedSynapse platform is not just a resource, it's a dynamic space where you can connect with your medical peers, participate in meaningful discussions, and contribute to the ongoing evolution of healthcare. So until next time, stay tuned. Take care.